Hello, this is a presentation on general physiology and depression. Introduction. Depression is an emotional state caused by low self-esteem. Relationship between the depression and physiology is that physiology is important in the treatment of the condition. That is why this topic is under general physiology. Physiotherapy causes of depression are feelings of sadness and hopelessness. Everyone is prone to this condition. It is not only experienced by a few people. Therefore, it's important to watch out for symptoms in order not to suffer from the condition without knowing. The following is a personal take of the topic. Physiology is the best treatment of depression. Most people are affected by the condition without their own knowledge. However, acquiring the depression knowledge will be vital for effective future treatment of the condition and control. Depression topic was specifically chosen due to its current prevalence rate all over the world. Many people are suffering from the condition, for it is important to enlighten them on the symptoms, the treatment, and even the causes of depression. The following are causes of depression. First, there are genetic causes. These are the causes which are within the genetic makeup of a person's body. Another cause is life events. People undergo many life events that may lead them to depression. Third is negative thoughts. Another cause is presence of illness. A person may be undergoing a certain illness, and during the course of treatment, they end up suffering depression, maybe due to the adverseness of the illness. Another cause of depression is brain injury. This can also be under the presence of illness. This topic is quite important, and the reasons for its importance are as follows. The information will be used to treat depressed patients. Secondly, the information acquired through learning about depression and general physiology will be helpful in preventing depression amongst patients in future. The topic is also important because it will be helpful in identification of early symptoms of the condition in order to help the person receive the help they need while it's still early. The information will also be used for future reference. Depressed patients will acquire an opportunity of learning various ways of managing their condition, so that apart from the fact that they are seeing a doctor or undergoing physiotherapy, they have the knowledge of managing their own condition. The following is where to utilize the information in personal lives or in career. The information will be used for health education. Secondly, the information acquired will be used to predict the future signs and symptoms of depression. The information acquired will also be used during depression therapy, either by the patient or the doctor, in order to conquer the condition. The information acquired will also be uploaded in the internet to be used as a source of reference and to enlighten masses about the condition. The following are types of depression that physiologists need to know. First, there is bipolar depression. There is also postpartum depression. There is seasonal affective depression, and there is psychotic depression. Effective treatment of depression. There are two common treatments known for this condition. First, there is the use of physiotherapy techniques, and secondly, there is the use of medication. Treatment of depression using physiotherapy. The patient is treated using the cognitive behavior therapy. In this way, the physiotherapist observes the behavior of the patient in order to address the thinking pattern of the affected person. Once the physiologist has observed and addressed the thinking pattern, he or she is able to help the patient by knowing the behaviors, the cognitive behavior, and the causes that have rendered this patient in depression. The drugs may be used in addition, or when the symptoms cannot be seen, the drugs are used to reveal the symptoms in the patient so that the doctor can know the extent of the condition and how to deal with it. Physical exercise is also incorporated under physiotherapy as a treatment of depression. The following are signs and symptoms of depression. Persistent sadness or persistent empty mood is the first sign of depression. Decreased energy and fatigue is another sign of depression. Increased appetite is a sign of depression. Thoughts of death is common among patients suffering from depression. Loss of interest in everything going on in the environment where the patient is, or the hobbies formerly exercised by the patient, is a sign of depression. Still on the signs and symptoms, difficulty in making decisions and loss of concentration or difficulty in concentrating is another symptom of depression. A feeling of guilt and helplessness is also a sign of depression. Restlessness or irritability, increase in body weight. This increase in body weight is as a result of the increased appetite mentioned earlier as a sign of depression. Lack of adequate sleep, caused by the restlessness, irritability, helplessness, thoughts of death experienced by the patient, cause them to lack sleep at night. Thank you. That is the end of my presentation. The references used are listed below.